Thanks for being with us again today. This is a building on the upper digestive difficulties that maybe many of you experienced. What I mean by building upon because the alimentary canal functionally starts really in your mouth and ends at the colon, at the distal end of the colon, at the anal opening. So this entire alimentary canal, which is feet and feet and feet and feet of distance of swirling and movement of the small intestine, of the large intestine, of the ascending, descending colon, the esophagus, the stomach, the duodenum. It gets complicated, right? It does. And I don't want to complicate this, and I don't want to give you a dissertation on anatomy and physiology. We just want to improve the function of your digestive system. So I believe it starts how we digest and how we assimilate. That's why we dealt with, in the previous live stream, heartburn, reflux, just upper digestive disturbances. This is not about inflammatory bowel diseases today, but not that you can't learn some things from this. So today, lower digestive disturbances, what would more be termed irritable bowel types of symptoms, not inflammatory. I'm talking today about colitis, Crohn's, qualifier. You can still learn some things in this arena. If you follow this, there are some principles that you could overlay to that. But right now, we want to just improve the whole lower digestive capacity. Last week, we worked on upper. This week, lower. I hope you're blessed by it. If you have some family members, ask them to tune in. Text them. Send them an email. Send them a text. They've got digestive problems. They're always complaining about bloating and lower bowel gas, and they have to run to the bathroom after they eat, and if they're at a restaurant, they have to go to the bathroom. They've got some irritable bowel-like symptoms. What if they have alternating constipation with diarrhea? Sometimes I can't go, and then there's days I'm going all the time. IBS. And really, medicine doesn't really have a solid mechanism to deal with this. They will use serotonin reuptake inhibitors that are antidepressants. They will use drugs. I'm going to draw a blank on them. One's Lotrinex, I believe is still on the market. Ametisia. Some of these drugs, one of them was pulled a while back because of dramatic side effects. They use one if you've got a lot of diarrhea, one if you're prone to constipation. They'll use, I think they're 5-HT3 receptor antagonists. You can use antispasmodics, old versions, hyoscyamine, dicyclamine. They can help you with symptoms. And not that there's anything wrong with trying to help you with symptoms, but we want to get after the functional aspects of this. How can you lower this trigger, this incidence that you have going on? I want to caution you before we go any farther. Please understand that this is not something that you do for 2 days and then you're kind of going to send me an email and say, I don't know why I'm not improving. Now, this is a lifestyle. This is you working at this. This could be weeks, months of you following this path. But before we get into that, I've already done like a however many minute intro there. Josiah tells me I talk too much. I want you to, you guys here, if you guys listen to the radio show, The Rugged Cross, this is I guess I should have, Chateau Sounds. You need to check this out. Seriously, it's going to be on our site very soon. It's there now. What, $5? Is that there? $5. You will be blessed. I listened to this. I can't tell you. It's right in my little CD player right here or whatever that thing is in my computer right now. It's in my car. Shelter. You guys wrote these songs, right? You guys did a little play on the old Rugged Cross, the old hymnal. You did your own version of that. There is hope, shelter, the Rugged Cross by my side. This is dynamite. You'll love this. I'm telling you, it's going to be on our site. $5, man. You got $5 to spend. Get the CD. Be blessed by it. I know I am. So much so that we use it at going to our break on the radio show and coming out of our break. We're going to modify the one version of that a little bit as soon as Josiah gets on the stick there. I think he just did. Blessed are those whose ways are blameless. Now, I am not blameless. I'm a bit of a schmuck. My life is a bit of a mess at times, and I'm sure yours is. and I got attitudes, and I develop at it. I get mad at my wife. She didn't do this, and I get mad, you know. How do I change that? You want to go through some behavior modification? If you're a psychologist, don't get mad at me. You want to change the way you think? No, how about if I allow God, the Word of God, to change my inner man and change how I express what I do to my colleagues, to my employees, to my children? How do I conduct my life? I have hidden your word in my heart that I might not sin against you. It ultimately starts there. God says that if you hide His word in your heart, it's ultimately about how and what we do in His presence. But you see, as we hide the word of God in our heart and we honor Him, see, then your life changes here. See, as I'm aligned here and I have relationship with Him, it'll change how I conduct business, so to speak, in my life here. Be good to your servant while I live, said the psalmist, that I may obey your word. Open my eyes that I may see wonderful things in your law. I am a stranger on earth. Do not hide your commands from me. My soul is consumed with longing for your laws at all times. And I guess there's a lot of things that could be key, but I'm going to just, block that one out. And I would say to you that if you're struggling with sin, with lust, with addictions, you're struggling with a marital issue, you're struggling in any area of your life, you pray this prayer, and I believe God will change. He won't just change your circumstance. He'll change you in the midst of your circumstances, and God will use you to be an agent of change. I am a stranger on earth. Do not hide your commands from me. Here's the key, verse 20. My soul is consumed with longing for your laws at all times. If we make that our prayer, that God, give me a hunger for your word and for your law, you watch. As you begin to seek God, you will crave it more. You'll seek the Word of God. God will change you, and your environment will change. I promise you. It's not my promise, because it's what this promise is to us. All right, let's roll. I'd rather just keep doing that personally, but I guess we got to do this. But there's people with digestive problems, man. Let's get this thing squared away. Let's help you with this. Let's do some practical application. So I'm going to talk about a bunch of junk, as I always do. I'm going to give you the irritable bowel, the IBS background. What is it? It's bloating, it's constipation, and alternating diarrhea, and it's lower bowel gas, usually below the belly button. And it's just discomfort after meals. Sometimes it's alleviated if you have a bowel movement. But Joe, I'm just not right. Well, first of all, you need to be checked medically. You need to be checked out. Maybe you need to have a colonoscopy. Not a big fan, but maybe you need to have it. But here's the point. The point is, let's rule out something disease state oriented. You say, well, this says IBS. Isn't that a disease? Well, not really. Because if you go to the doctor and you say, someone said I have IBS, can you verify it and diagnose that for me? Can you do a colonoscopy, do some blood work, and show that I have IBS? Can you document this for me? The answer should be no. What? You mean irritable bowel syndrome, IBS, is not a disease? No. You mean to tell me you can't document it with a lab, a test? No. What is it based on? Symptoms. So you go to your doc, they do a colonoscopy, say you're okay, we removed a couple polyps, you got a couple polyps, they're okay, they're not cancerous, you're good. Whew, praise God. But what about this bloat and gas? What's that? What about this stuff, man? I got all this stuff going on in my gut. You can't just diagnose it. It's a functional disorder. You got that? It's functional. It's a functional disorder as the phone rings. It's a functional disorder. So what am I after? What are the causes? Let's try to get there. You say, Joe, but you said it wasn't a disease. What are the causes of the dysfunction? Functional disorder. I believe this is not the cause, This is a trigger, stress, and anxiety. Why? Why would Joe say that? Well, because I read some articles last night that document with MRI imaging that individuals with a tremendous amount of anxiety and stress that have a lot of digestive, upper digestive, heartburn, reflux, yada, and lower bowel issues, that they can document in individuals that have a lot of intestinal stuff, there's actually changes on their MRI scans versus those that don't. So you say, oh, is this the cause? No. But we know when Len and I did the broadcast together years ago, we started talking about 6 or 7 years ago, a gut-brain link. There was an article, I don't know where I pulled it from. I was like dumbfounded. Like they finally, so I've got something to document this, that what goes on here is dramatically affected by this. And what goes on here, how I handle distress and stress in my life, affects how I digest and how I eliminate. So there's a key link. So what do we do? In many cases, we'll use SSRI drugs like maybe Lexapro and Celexa and so on. Why? Because they want to try to modify serotonin metabolism. Why? Well, serotonin is made in your brain and your CNS, helps your mood, etc. But serotonin is made elsewhere in the body, kidneys, lining of the stomach. So some patients, some folks respond to drugs, SSRI pharmaceuticals. I'm not telling you that's what I want you to do. I'm just telling you what are some of the causes and links. So stress and anxiety is a trigger. Poor serotonin and inerrant serotonin metabolism in the gut. Do you know also that some of the literature shows that folks that have IBS symptoms actually have distorted perception of discomfort in their gut? So they're almost like trying to say it's a psychosomatic thing. I'm not so sure I'm buying into that. But it's very possible that some of you have a heightened sensitivity in your bowel and your digestive tract. That's why you have more symptomatology. Small intestinal bowel overgrowth, SIBOs. All that really means is you got a lot of bad bacteria growing in your stomach, and that impairs the whole digestive process. That impairs the elimination process. Anxiety and stress. How are you dealing with that? Do you sleep well? Do you find that every time you're under some high levels of stress, or you have an appointment that you have to be at, or you have a presentation to give, that you just know that your stomach goes ballistic and your bowels go ballistic? Stress and anxiety. Maybe not a cause, but certainly a trigger. How you're dealing with that is critical. And I would have to tell you that it kind of starts with this. Medication. Do you realize that if your daughter has a lot of digestive issues and she has cycle hormone disturbances and she's using non-steroidals like ibuprofen, they're over the counter, no big deal, naproxen, ibuprofen, you can use them. Doc says I can use them. What's the big deal? Big trigger, big link to irritable bowel syndrome, non-steroidal drugs. Do you realize that the purple pill? So do you see why I said when we started we were going to start from the alimentary canal here and just work our way down, upper and lower digestion? You say, Joe, you're not a medical doctor. How are you qualified to talk about this? Well, remember what I said. Your doctor can't really medically, he can diagnose you with this, but he can't document that you have this. There's no test. There's no lab. The colonoscopy can't document IBS. It's functional. So I'm very qualified to talk to you about this. Very qualified. Meds, acid blockers. PPIs are a big trigger in this area. So if you've got upper digestive problems, heartburn, reflux, and you're using those acid blockers, which we taught you in the previous live stream, why you need to really reevaluate that situation and improve that, what you're doing is you're opening the door to lower digestive problems. Antibiotic histories. If you've had a significant antibiotic history due to sinus infections, asthma, or whatever, maybe you had Lyme's disease, maybe you had a MRSA, methicillin-resistant staph infections, and you've been on antibiotics in a couple of years, not even a couple of weeks later or after you were off of them, you started to notice digestive problems. It could be months to years before this unfolds. Antibiotic exposures. You say, great, Joe, it's all you ever do is give me the negatives. Tell me what it is. No, you have to understand this, because I can't go to maybe what your approach is unless I help you deal with an understanding. Because if I'm working with you and you're still doing the non-steroidals and you're still taking the acid blockers and you've got overgrowth of bad bacteria and you say, Joe, I mean, and you are so stressed out, Joe, what you're doing and what you recommended doesn't help me. Well, these are meant to augment and support when we deal with some of the underlying triggers. Food sensitivities. So we dealt with meds. Food allergies. Now this cuts a lot of different directions. I don't even know how to put this out there. First of all, my writing's atrocious, so I figured the less I write, the better off I am. But, or maybe the better off you are. Food sensitivities are a problem. So food sensitivities, first of all, be allergies. Can I have allergies to foods that I consume? True allergies. Wait a minute, I thought that gives you hives. Well, it can give you hives and skin rashes. It can give you headaches and migraines. It can wreak havoc with your digestive system. Food sensitivities and food allergies. So maybe at some point, we'll discuss, you might have to be tested for some food allergies to see if are there foods that you're consuming that are a trigger to your IBS. It's very possible. Gluten and dairy. Gluten intolerances, big issue in this area. Dairy, big issue in this area. FODMAPs. What are FODMAPs? Now, I always kind of forget what they are, so I have my little FODMAP folder. So what are FODMAPs? FODMAPs are fermentable oligo-di-monosaccharides and polyols. So what is that? Fructose, high fructose corn syrup, big trigger, FODMAPs. So you have IBS, even upper digestive issues, and you have a lot of bloat and gas. Just think about this. This is not truly an allergy. This means that you just don't process these types of carbohydrates well. Number one, high fructose corn syrup. Significant, like high amounts of sugars, bad deal. They ferment. Fermentable, oligo-fermentable, the key word. Dairy, lactose, ferments in the gut. FODMAP, big trigger for IBS. Fructans. Now this gets a little tough here because onions and garlic are fructan-containing foods. Some of you will notice after you've had onions or even cooked onions or garlic, you have digestive problems. You have a problem, unfortunately. I think you can improve this process, but you might have a trigger. But the real key is wheat. Wheat is a fructan. So now you'll see, well, wait a minute. Oh, well, you're confusing me. Gluten allergy. Well, not really. I think I'm getting ahead of myself. I should have did this later. But gluten, dairy intolerances, dairy would be different in the sense that it wouldn't fall into a FODMAP, but dairy and just plain fructans that are found in wheat, you might not have an allergy. You might not have celiac disease. You might not have a gluten intolerance, but you have a problem digesting fructans that are found, fermentable components that are found in lactose and in wheat that cause bloating and gas and distension. FODMAPs, big issue. Female hormone imbalances. Female hormone, and we're going to go to break in a minute. Do we have any questions, by the way? You can fire away some questions if you'd like. Go right at the website, fire away questions. Hopefully they're a little more topical. If they're not, we'll still deal with them. FODMAPs, fermentable oligo-di-monosaccharides and polyols. What else? Polyols. Let's get to this real quick. If you consume sugar alcohols, maybe you chew gum, maybe you eat foods that are going to have some of these ingredients that I'll list for you, and you never put two and two together. I want you to start looking for ingredients that are sugar alcohols in anything from gum to foods that you consume. You say, oh, this one didn't have any sugar. It says it has a sugar alcohol and I can eat it because it doesn't raise my blood sugar. And you've never linked or tied that you get bloaty and gassy and distended a couple of hours later and you have strange bowel movements. Sorbitol, mannitol, xylitol, maltitol, sugar alcohols, you need to think about it. Falls into this FODMAP. Polyols, that's where the P comes from. Polyols fall into this category. Unfortunately, there are some fruits and other components. In some cases, some folks will have problems with avocados, apricots. I don't really like to go there. High fructose corn syrup, dairy, wheat, watch your garlic and onions, that can be a trigger. Sugar alcohols. There's some literature that talks about beans and legumes because of the galactans. I don't want to get too crazy here, all right? The real key is watch the biggies. Wheat, dairy, sugar alcohols, those are your big guys. FODMAPs as a whole process could be an issue, but those are certainly the big ones. So, before we go to the break, bloat, constipation, gassiness, diarrhea, lower bowel discomfort, causes, I don't know. How about triggers would be a better thing? Anxiety and stress, big issue. Remember, what you learned last time is that under high levels of anxiety and distress, your digestive system is altered. You diminish your digestive capacities. And I should put this in because this is key too. Low hydrochloric acid production will come from this. High stress, high anxiety, I compromise my digestive capacities. That can lead to the symptom or symptomatology or the manifestation of irritable bowel syndrome, gas, bloat, lower bowel dysfunction. I could have an altered serotonin metabolism. Does that mean that I have to go on to an SSRI pharmaceutical? Not necessarily, although some people do respond to that. I would hope that we don't have to go that route. I could have bad bacteria growing in my gut. As we close this, as we wrap on the backside of the break, I'll talk a little bit about that, how we clean up the gut. I could be using medications, and there are more, by the way, but I try to keep this simple. Proton pump inhibitor, the acid blockers over the counter, non-steroidals that I might be using for arthritis or inflammation. Antibiotics will absolutely open the door to irritable bowel symptomatology. Food intolerance, food allergies that you might have to be tested for, or you just start getting off things like gluten, dairy, wheat-based products, the FODMAPs that we talked about, especially the sugar alcohols. Look for them, malatols, xylitols, right? Understand this FODMAP concept that we just talked about. They can be a trigger. Women, notice that IBS symptoms flare or rise in conjunction with their cycles. Many times later in the latter part of the month, they develop all types of lower bowel and digestive disturbances. The word for you then is we have to balance your hormones first. Your hormones need to be reset, and that many times alleviates a lot of the IBS symptoms. Low hydrochloric acid is produced by the parietal cells right in the stomach. Pancreatic enzymes are produced by your pancreas, protease, amylase. So why we're going to talk a little bit why sometimes we just need to do digestive enzymes, right? Some digestive enzymes. But low hydrochloric acid and low pancreatic functioning, and you might be thinking, what does that have to do with what's going on in my lower gut, below my belly button, down in my large intestine and in my ascending, descending colon, and all this pressure and bloat and distension, and they tell me there's no disease, praise God, but what is that? It might be emanating from poor digestive capacity up here, the stomach, and I am not assimilating, breaking down these foods. They are fermenting, they are putrefying as they're moving through the digestive system. So we might have to improve just your basic digestive capacity so that we eliminate difficulties farther down in your digestive tract. Once again, that sounds like a lot. It's really not. Know that we got to manage stress and anxiety. We've got to make sure we don't have bad things growing. We've got to make sure that we're not using other medications, and some of them are over the counter that are a trigger. We may have to get food sensitivity testing, but as a starting point, let's deal with some of these issues. Know what FODMAPs are. We'll cover that again after the break. Female hormone imbalances and low digestive capacities, all a trigger. All right, we're going to go to a break. I want you to stay with us. When we come back from the break, we're going to kind of wrap this, how you can, questions. We'll deal with some questions after the break, and we will absolutely try to give you more of an ABC format as to what you can do to improve your, we already did upper, now this is lower, so you stay tuned. Give me a minute. I'm going to clean this board up. We'll come right back. Listen to this. What do you have going on here with this word? Forever Rain, Hillsong. Love it. Stay tuned. We'll be right back. Thanks for being with us. I hope you enjoyed that. And I know I always do. And Josiah were just talking at the break, and probably going to make some changes coming in the near future here. So we hope you're enjoying this. You could do us a little something. We want to up our game, so to speak, to use Josiah's words. So what we want you to do is, if you've got friends, family members, it doesn't matter where they live. They could be overseas, for goodness sake, in the service. They could watch these live streams. Computers are just amazing as to what they do. Many of you watch or listen to us on XM Sirius Satellite. Many of you listen to us in the Pittsburgh area and Boston. But remember that the computer hooks us up at any point in time that you can view these. And we've got a bank of them. And I think over time, we might even do some redos on some of the ones we've done, I think, just to do them better. We got a lot of we got everything from how you can exercise with some bands that you don't hurt yourself. You should go back and view that. Dante, my youngest son, actually did some of the demos. He did a great job. He's a 20-year-old kid. I mean, he did a great job with it. You need to go back and view them. So we've done things on joint health, on protecting the cardiovascular system, protecting the brain, enhancing digestion, and not with a medical perspective, because medicine will give you drugs and pharmaceuticals, and my background is pharmacology, and I know all about that to some degree. I know about that, and I understand the role that they play, but why don't we do some things that are, I hate to use the word alternative, because it is not alternative. Can we do some things that are complementary versus medicinal? So IBS, irritable bowel syndrome, let's move on. Medical treatments, there's more than this, but the basic medical treatments are, and we're going to contrast them. You say, Joe, you got a long list, brother. You lost me. Or no, that's not. I just kind of reiterated some of the things that we've already talked about. What does medicine do with IBS? Excuse me. They'll use bulking agents. Bulking agents are things like insoluble fiber, psyllium husks. And frankly, I'm not real crazy about that. You find some folks, it'll help because they just don't have enough fiber in their diet. So enhancing their elimination just helps them automatically. A lot of folks actually react to the psyllium, honestly. And especially if it's not a clean source of psyllium, they can react to it. So I think there's better ways to go with that. We have a product called Regularity Fiber Guard, totally different. But medicine does their treatments. The GI specialists will say, okay, we're going to get more fiber into your diet. So a bulking agent that has insoluble fiber. Now, that's not bad. We need that. That helps the process of elimination, but I'll contrast that in a few moments. SSRIs, they'll many times put you on an antidepressant med. You say, Doc, I'm not depressed. Why would I use that drug? Well, it's serotonin activity in the gut. Remember, you got serotonin receptors. So there might be a rationale. So here's medicine's approach. More fiber, a bulky fiber, insoluble forms, put you on an SSRI, put you on medications that act locally in the GI tract, 5-HT3 receptor antagonist, I believe, Amitesia, Lotranex. There was another one, and I can't remember if it was Lotrin, but there was another one out there at one point that was pulled off the market because all kind of side effects. Locally acting drugs. You have other locally acting drugs that are old as the hills that actually help you with the symptoms, and I wouldn't deny that. Antispasmodics, hyoscyamine, bentyl, dicyclamine. But once again, they're not dealing with the root. But if you say to me, Joe, but sometimes I get very bloated, and it's actually very, very uncomfortable, and that dicyclamine helps me, or that hyoscyamine, I put it under my tongue. You can do a time release, a sublingual, and it helps me. I don't think that's the end of the world to do these. Not as crazy about these drugs. But these two just act right on this. It relaxes the gut. Can be helpful. Okay, not the end of the world. All right, so this is the medicinal side. So IBS, the treatment of irritable bowel syndrome, is very, you can see, pharmacologically oriented. Only one of these uses a natural agent. Pharmaceutical, 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 right? You get the drift here? Okay. Complementary approaches. Not alternative, seriously. I almost want to get that out of my vocabulary. How do we complement health? How do we just help ourselves? How do we complement it? Things can go bad from a variety of aspects and reasons. The anti-inflammatories, the H2 blockers. I take meds. They told me to take this. I had a MRSA infection and wouldn't go away. And it took 3 different antibiotics. And it took me 6 months to get rid of it. And it's a nightmare. And a year later, you've got all this digestive problem. You didn't ask for that. You developed it. But now do we go back to more of this? Or do we try to get you to complement health? All right? So back to the complementary side. What am I after? I'm going to say number 1. Where is it? I'm telling you, there's a big link right here. I got to get you dealing with the stress in your life. And however you do that, I always feel like I'm preaching at you guys. I don't want to preach at you. But you're having digestive problems, begin to praise and worship Him. I mean that. In your car, in your vehicle. Get Chateau sounds. I do it. I use it. I'm telling you, this has become a blessing in my life. You guys it's on the website. Go get yourself 5 songs. You'll be blessed by it. Worship and praise, honoring Him. I believe as we honor Him, God will give you insights. I'm telling you, I believe as to where your problems are. I mean, this is going to sound stupid, but my lower back's been killing me the last probably 2 to 3 months. And I could be places and I'll just say, Lord, you know what's wrong with my back. And I even asked God about how to stretch my back. I mean, seriously. Stretches that I would have probably never done, I do, and they help my back. And I can't say that there was an audible voice. But we were at the grocery store 4 or 5 weeks ago. And I'm thinking, Lord, I can't even walk around this grocery store, man. I need to get on the floor, do my other stretches. And it was just I just started doing cross stretches that I never really did before. It was within 2 or 3 minutes, my back just lightened up. That's wasn't some rhema word from God, but I believe that He's worried about, I don't use the word worry, but God's concerned about what concerns us. I believe that if you honor Him, I believe God gives us wisdom and He'll reveal things to you. Stress reduction. Let's get to the root of your stress issues. Are you not sleeping? Are you not sleeping? If you're not sleeping, there's no way that we can deal. But Joe, give me these supplements. Give me the stuff. If you're not sleeping, don't buy the stuff. Let's get you sleeping first. If you're maximally stressed out because of heartache in your life, my heart goes out to you. I can't make your heartache go away. But that's why I read Psalm 119 is where I just felt really led to just go there. I've been teaching a lot of different things during the week about Ruth and all that. And I feel like sometimes we just need to hear the Word of God that just literally tells us what to do. Maybe not even what the principle is, but the psalmist said, I got to honor you. I'm going to hide your word in my heart. And you'll keep me. You'll keep me from sin. You'll keep me from mistakes. You'll be a lamp unto my feet and a light unto my path. This is not magic, folks. This is the Word of God. This is real life stuff. I got to get you dealing with the stress. I would say next, we've got to get you eliminating things, the elimination diet. We've got to look at the gluten and the dairy. You said, Joe, that's really hard. I know it is. I didn't say it was easy. Nowhere in this concept does it say it's easy. See, this is easy. Just give me the med. I'll take the side effects, but just give me the drug. This is easy. This is not easy. And if you're watching this, I'm assuming that you understand that these aren't always easy way outs. Okay? So we've got to eliminate gluten, dairy, processed foods. I got it at the bottom of the list. This is huge. Do you know that a lot of folks have huge issues with restaurant foods, processed foods, foods that have chemicals? If I could tell you one thing that you must do if you suffer from lower digestive disorders, you've got to watch the amount of chemicals that are in the foods that you consume. if you eat a lot of restaurant food, you eat out a lot, they are loaded often with sprays and chemicals that preserve, that keep. Preservatives are a big trigger. I believe we can re-enhance that, but there might be a period where you've got to really reduce that. So processed foods, I already discussed in detail FODMAPs. I'm not going to bore you. We know gluten and dairy, it's a big trigger. We know at some point in time we can just do kind of the elimination diet. We might have to do some food sensitivity testing. And believe it or not, there's a shocker. God built you to move, right? Exercise, physical activity is shown to reduce the symptoms and the incidence and the severity of IBS. Doesn't all this sometimes come back to the same basic principles? It really does. Exercise, movement, physical activity, learning how maybe not just reducing stress and not going through behavior modification and not becoming Pavlov's dog, but really reordering and redirecting your life with him. Remember we talked about this, and then how it then helps us deal with our circumstances or a difficult marriage or a difficult work environment, etc., etc. You don't like wish upon a star your stress away. I believe you've got to ask God and honor him, and it improves your coping mechanisms. Female hormones, if you're a woman and you're watching this, and there's a link to your cycles, we need to do a saliva hormone test. If you're perimenopausal or menopausal, many times that's when this begins because women's hormones have altered, and I don't know what that mechanism is. I really don't, but it's there, and we know it's there. So female hormone disturbances. And then I believe now we just get into support. Well, first of all, if you're not using probiotics, big mistake. Now we can use more sophisticated versions of this, like an Ultraflora IB. It has much higher doses of certain strains. Yes, but how about the basics? How about high doses, 3 twice a day? Empty stomach for those of you with IBS. All right, so how about some probiotics? So I don't know where I had that on here, but somewhere. Probiotics, okay? What about enzymes? Why enzymes? Remember that if I'm under a lot of distress, or if I have a lot of other issues going on, or I'm just not digesting well, do you know, you saw it up here before, low hydrochloric acid production is a trigger for reflux and heartburn. You already learned that, not necessarily too much. And the other part is not enough hydrochloric acid and digestive capacities can be a trigger for poor digested food that begins to ferment and putrefy in your lower bowel. Hence comes the bloating, the gas, the distension. So, in many cases, how about 2 digestive essentials with main meals, maybe lunch and dinner? Probiotics, digestive essentials, just a good starting point. How about, you said up here they did bulking agents, it was just fiber, right? Why don't I just use Metamucil? I think a much more reasonable approach is something like Regularity Fiber Guard. And let me show you why. Here's the difference. The Regularity Fiber Guard has a standardized crafted form of wild Arabic gum, which is acacia gum, which is a very natural source of fiber, glucomannan, oat fiber, dextran, which has FOSs in it. A really very natural, completely natural source. And I was looking for one other component because I think it gives you a breakdown as to the soluble. Well, they used to, and we don't have it on our label. The soluble versus insoluble version of this component. This doesn't mix real terrific in water. What you might have to do is mix this with some buffered C, and then I just killed my, whatever this thing is called. But Regularity Fiber Guard, excuse me, can be a huge benefit. So you say, well, then you are in agreement with this portion. Yeah, I am. Notice I said, these are all the medicinal approaches. This is the only part that's non-medicinal. I just disagree with the type of bulking agent that they recommend. Okay? So fiber is key. Food sources of fiber are even more key. Yeah, but you told me to get away from some things that have fiber. Yes, but you can do oat fibers. You can do steel-cut oats. You can eat apples. You can eat foods, vegetables that are rich in fibers, soluble fibers and insoluble fibers. Chew your food well. We've got to get more fiber. If you suffer from constipation type of IBS, where you really don't have bowel movements and you go 2, 3, 4 days and you just have a lot of pressure and bloating. And we've got to get you on I didn't bring the Buffered C. You're very familiar with the Buffered C powder. How about a teaspoon in the morning, teaspoon in the evening, 6 to 7 ounces of water. Mix it with a scoop of the Regularity Fiber Guard. 1 scoop of the Regularity Fiber Guard has 7 grams of fiber. 7 grams, 1 scoop. And the right forms. 1 scoop in the morning, 1 scoop, and it gives you about 14 to 15 grams, and then you get the rest from your food. Buffered C. Enhanced digestion, digestive enzymes. The other 2 that I did not cover, that I failed to deal with, we talked about the processed foods, the chemicals in foods, the more processed foods, prefabricated foods you consume, pop-in microwave foods, restaurant foods, the greater your trigger. I take that to the bank. The other thing is alcohol and caffeine. Now, I have 1 cup of coffee just about every morning. Don't have a problem with that. I don't think caffeine is evil. It's really not. Actually, there are some very positive attributes to caffeine. I just think we do too much. We drink 20 ounces. I have a legitimate 6 to 7 ounces of coffee, and that's it. I love the taste of coffee. I love Italian coffee. I love espresso. We just don't need to do a lot of it. For those of you that are still struggling, you get on probiotics, you do Digestive Essentials, you do Regularity Fiber Guard. Some of you need to just repair the gut. Now, you're familiar with the GI Restore because we discussed that on the upper digestive issues with heartburn, reflux, healing and repair. Well, a lot of you have issues here, healing and repair, but many of you that have lower digestive issues need healing and repair in the lower gut. Why? There's arabinogalactanes in there. Excuse me. There's glutamine. There is aloe extracts. I mean, you have slippery elm. You have about 7 different nutrients. Zinc carnosine is in here. Zinc carnosine, the Japanese documented almost 20 years ago that zinc carnosine was a huge combo prep that could help with heartburn and reflux. That's why we have it in here. And also with irritable bowel. Many folks have irritable bowel because your intestinal tract is not inflamed as if in colitis or Crohn's, but there's low level of inflammation. It just needs healed. And when it's somewhat raw, you just don't assimilate and eliminate these foods well. It's about the basics. Still, make sure you learn what we discussed earlier about chewing your food well, taking time, do some of these elimination issues, do the supplementation. So you have the traditional medicinal treatments, and then you have the not so easy complementary approaches. But I believe that for example, pursuing God in the midst of difficulty isn't always easy. Jesus said that the path that you have chosen, it's a narrow one, and there's a narrow gate. No one enters but by me, said Jesus. And he said that road is narrow. I mean, there's not that many people on it. See, and this is the road that, that not many want to follow, because this is, remember, the easy route. This is not so easy. This is, I believe, restorative and curative. This is just managing symptoms. So if I stop my bulking agent, stop my antidepressant, stop my amatesia, stop my dicyclamine or hyoscyamine, my symptoms pretty much return. And actually, people still have symptoms even when they do this, by the way. But, all right. I hope you get something. I hope you learn something today. What do we got in the way of questions here? I have a question about stomach feeling so hard all the time. I wrote to you before about my husband, had testicular cancer. He's healed from it. I mentioned before doctors want him to do CT scans. In any way we can get detox pills. Well, what I would have you do is Detox Essentials and NAC, 2 of those, 30 minutes before meals. NAC 600, 2 twice a day before meals. Start 3 to 5 days before the scans, the day of, and 3 to 4 days after. Do 1 Detox Essentials, same way before the meals. Call the off-air number, 888-865-9595. Speak to Terry. He feels fine some days, but the times his stomach feels hard. He says it's fine. Feels hard. He says if he has fine bowel movements. I don't know. I'm not. And he doesn't eat junk food. We stay away from all fried foods. He eats veggies and fruit, grass. He sounds like you're eating well, so I'm not following. What I would assume you're trying to tell me is he feels fine some, but most of the time his stomach feels hard. He says he has fine bowel movements. In other words, maybe he's not having difficulties there. Well, he has some IBS type issues, possibly. He takes beta TCP. That helps with liver. Takes Livotrit, put on him by his chiropractor. I'm familiar with those. I don't have a problem with that. He had 1 or 2 beers. It feels like it relaxes. Does not smoke. I mean, I still think he needs to look at some of the things here, and he thinks it's caused by the CT liquid, the contrast dye. I don't know if that's necessarily true. I don't believe that. The contrast dyes have to be processed, liver, kidney, especially the kidneys. That's what we're after. Well, what do you say we wrap this up? We kind of already over, I believe, our allotted time. God bless you. Thanks for being with us today. I hope you've taken this message to heart. Share it. Someone else, your family has digestive problems, they can go back on and view it on our live stream page, right on the archives. And hopefully over the next month or two, we're going to do some things. We're going to up our game, so to speak, to make it even easier. It'll be directly embedded. Is that correct? Right on our site, right? It'll be a lot easier. Because right now, sometimes there's a little delay. Sometimes I even go on to just see what's going on. And it takes time sometimes to come up. I know that. If you guys keep viewing, keep watching, you're blessed by the time we'll up our game. It just costs money and it's time and it's expensive, but we will certainly do more. God bless you. Thanks for being with us, and I mean that with all my heart. And I don't know what the next topic will be. We'll come up with something. Blessings to you. Have a great, great day.